Welcome, everyone, to this podcast series presented by the Global Positive Health Institute. My name is Dr. Liana Lianov, and I'm the president of the Global Positive Health Institute. And at this podcast series, we talk about all things related to positive psychology, health, and healthcare. And today, I'm delighted to have as our guest Dr. Gina Duncan. She's a psychiatrist in private practice in Charlotte, North Carolina, and she has written about and spoken about the topic of culture, positive psychology, and psychiatry. So we'll dive into that as well. Welcome, Dr. Duncan.
Thank you. It's great to be with you.
So we'll dive right in. You have a passion for positive psychology. Tell us how you came across positive psychology and why you're so passionate about it.
Yeah, I do. I was thinking about how to answer that question, and I would answer it in this way. When I was in residency, my psychiatry residency training, I was introduced to the concept of the strengths-based approach to mental health care, and really gravitated towards that. And I think it dovetails with my upbringing and my spiritual frame of reference and kind of my general ethos about life. When I moved into a faculty position after finishing residency, I was on the faculty of the Medical College of Georgia at Augusta University in Augusta, Georgia. And while there, I was a member of our Project GREAT team. That's Georgia recovery-based educational approach to treatment. It was a recovery model focused approach to mental health care that the Department of Psychiatry had adopted and kind of infused those recovery principles into the training. We had certified peer specialists, and shared decision-making was also a big part of that. And before I left Medical College of Georgia in 2015, our team was beginning to also incorporate positive psychology into the workshops that we did and some of the other efforts. And so that was when I was really introduced to the field of positive psychology specifically. And I think, again, sort of naturally gravitated toward it and felt this just makes sense. As a psychiatrist, I definitely feel that the field of psychiatry in general traditionally has had more of a deficit-based approach to mental health care. And I again, am a very strengths-based practitioner and have that kind of strengths-based view of people and patients that I'm working with. And so after learning about the field of positive psychology, I kind of wanted to find ways of melding that into my practice. And then a few years ago, I was invited to collaborate in writing a chapter about positive psychology, positive psychiatry, and culture. And so that kind of took me further into my study of it.
Well, it's amazing how we had the field of psychiatry and psychology, both fields, for decades that were, like you say, more deficit oriented, all about getting rid of illness, getting rid of negative emotions, bringing people back to, quote, normal. And there was never really any discussion of, well, what goes beyond that? And what about the positive side of things? Or can we have both the positive and the negative? And how do we hold both of them in our lives? And so we're, of course, grateful that this field of positive psychology has blossomed, and there's so much more work we have to do with it. And we're discovering so much. I mean, researchers in the field is discovering so much that may really flip things around. And maybe it's the positive we start with and then deal with the negative.
Right. No, I definitely agree. And I think that, again, that the recovery literature, the idea that illness doesn't have to go away in order for people to live meaningful and full lives and have well-being. And so, again, like you were saying, the idea of holding both at the same time. It's possible to have a chronic mental illness and also experience a high level of meaning and value and purpose and well-being too.
Yes. And so along those lines, how do you use positive psychology? Do you have some favorite approaches for yourself?
I I would say definitely the virtues, those like 6 virtues of positive psychology are all virtues that I resonate with. My personal faith background is very important to me, and that is, I think those virtues also resonate with me from a faith perspective, and so that's a natural fit. But the practicing gratitude, the positive things, identifying positive things that have happened in to me in a day or over the course of a week, actively using those. I try to practice that every day, but actively using those sorts of exercises and strategies, particularly when I'm not feeling so positive, that is definitely something that I aim to do and to incorporate. Seeking out activities and things that give me a sense of meaning and purpose, journaling, writing, time with friends and family, reflection, time for reflection. I'm fortunate, I'm very fortunate and blessed in that the work that I do as a psychiatrist, I really feel a great sense of meaning and purpose in that. And so on a daily basis with my work, as I'm helping people, I think that allows me to experience a lot of positive emotion. Doesn't mean that every patient encounter is great or that there aren't stressful times, but that the takeaway that I get is one of a sense of positive emotion and a sense of being able to flourish. Again, that's a work in progress, but those are some of the ways that I try to incorporate it into my life.
Yeah, sounds like, well, certainly your work is a source of your overall, not only career satisfaction, but life satisfaction by adding that to meaning and helping others, et cetera.
Definitely. And I would say that I learn a lot also from my patients. I'm very inspired by the people that I work with who, go through very challenging times, and, to be there with them in those challenging times and also in their joys, and seeing the strength and resilience that they have also helps me in my own life.
It can certainly be inspiring when we are able to see others who are struggling make it through. And
Yeah,
certainly as a psychiatrist, you're seeing a lot of that.
definitely.
Yeah. And so speaking of you then professionally, how do you use positive psychology professionally? Do you prescribe some of these kinds of interventions and approaches to your patients, et cetera?
It's funny, but as I think about it, I don't think I've ever actually had a conversation with a patient where I've said, I'm going to recommend that we do some positive psychology interventions, or I am approaching your treatment from through the lens of positive psychology. I think that I just infuse it into my work in a way that just feels kind of fluid and normal. I think if you were to look at my treatment plans and look at the recommendations that I make, they fall under the heading of those positive psychology interventions in a lot of ways. Often I will think about and work collaboratively with the patient to identify 1 or 2 things at each appointment that they could do that helps them to move closer to a goal of wellness. And oftentimes that involves connecting with their family or their community, or reaching out to someone else, or doing some activity that brings them a sense of positive emotion. So I do infuse those into my work. But I think it's also important, as I'm reflecting on this, that it's not just about what we do, about the interventions that we use as health practitioners or professionals, but also the way in which we do it, the way we communicate, those nonverbal messages, the tone of our voice, the energy that we bring to an encounter, that is important in conveying a sense of positivity and creating a sense of your belief in the well-being that this patient can achieve. So those are some of the things that I try to do in my work.
Yeah, as you're speaking, I'm reflecting on some of the training that we do through the Global Positive Health Institute, and we're actually putting together a larger course. And we do, I think of it in chunks in terms of positive psychology has a role in when we assess someone and what are they already doing in their lives that comes from that positive vantage point, and how can we get them to do more of that. So there's the assessment piece, and then there's that interaction piece and using positive emotions during the encounter to invigorate and inspire and drive that behavior, get them motivated to do some of the things that will help them with their well-being. And then there might actually, be some very specific prescriptions, like say, maybe a lot of practitioners may think of elements of positive psychology, but not label them as such, but yet they're integrated in what we would consider a total well-being plan.
Right. Yeah.
And being role models ourselves in the encounter is a great place to start, even if people say that that's about all that they can handle, but we can be role models.
Right.
So tell us a little bit then about this topic of positive psychology and culture that you've been thinking about, writing about, speaking about.
Yeah. So, I know I'm not the only person who has written about positive psychology and culture, but, some of the main takeaways that I have written about and think are important to talk about or recognize is that, first of all, I think the field of positive psychology is a wonderful field, and I think it's very much needed. And I think it's largely applicable to most people, and regardless of their cultural background. I think there are some nuances that are important to recognize. And so, one of those is that the field of positive psychology has been developed primarily from a Western or European American frame of reference. And that doesn't mean that there's not, that it's not applicable to other people of other cultures and backgrounds. With regard to the principles and the methodologies, but it's important to recognize that some ideas or perspectives, may not be as relevant as others, or may not resonate quite as well. And so that's because, the second point that I would make is that thinking about cultural and ethnic minorities in the United States, most groups that are cultural and ethnic minorities in the United States tend to come from cultures that are more collectivist rather than individualistic. And so again, it doesn't mean there's not overlap of values, but there are nuances and differences. And so some of those values and norms may actually sometimes be in conflict with the individualistic kind of norms of the dominant culture. And so as a result, the pathway to well-being may be viewed differently. And so, for example, if I, as a practitioner, am coming from the more dominant culture view, working with a patient or client who is coming from a more collectivist view, my idea of what well-being might look like for them and what activities, what positive psychology interventions might be best for them might not actually resonate as much. They may value or appreciate more doing things that will tie them into their community, into their religious body, into the sense of purpose that they derive from helping others, as opposed to some of the more individualistic activities. Again, these things aren't mutually exclusive, but I just think those are some of the nuances that are important. So I think it's really important that, as always, and this is just good practicing good healthcare in general, walking with a level of humility when we're working with a patient, not assuming that we know all aspects of their culture, even when we come from similar cultural backgrounds, not overly, assuming that we know all about them. The third point that I would say that I've written about and think is important is to recognize that, particularly in the United States, individuals who come from backgrounds where they are a cultural minority, they often possess what have been termed adaptive strengths. And these are strengths that have come specifically from the experience of being part of a marginalized group, and that have helped them to survive and navigate in this culture. And those adaptive strengths are not generally part of mainstream positive psychology literature, but maybe a really important aspect of a person's identity and background, that if we're aware of those, we could tap into and help them achieve a greater sense of wellness and move towards flourishing.
I like that. I've certainly written about strengths, and my most recent book is called Strengths in the Mirror. And I talk about strengths at many levels: character strengths, brain strengths, self-identified strengths. But I like this adaptive strength. So I'm going to be adding to my repertoire. So thank you for that.
Yeah, Constantine and Sue are two of the authors. They've done a good bit of work. I think they had an article in 2006 that really kind of talked about that term, adaptive strengths. I think it is a great one to look into.
Yeah. And there is so much more research that we need to be doing around this intersection between culture, cultural differences, and mental well-being, emotional well-being, positive psychology. And like you say, short of that research being there and giving us sort of conclusive guidance, we do have to have that humility, like you say, and just step back and help patients and colleagues and others who are interested find their own way to what works for them. And where I've run across that in the literature is Kristen Layus writes about person activity fit. So as we're talking about certain positive activities with patients, people we're counseling, is to really dig deeper and figure out that best fit. You know, sometimes a busy practitioner doesn't have time, but at least even having the awareness and nudging the patients to explore for themselves, giving them some options and letting them again to test out. And it might work for some people, it may not work for that person, and then they try something else.
Yeah, completely agree.
Yeah. So we've mentioned a few resources. What are some of your favorite resources on positive psychology?
Well, the book that my chapter is in is the book Positive Psychology, Positive Psychiatry, and Culture. Actually, I'm sorry, I'm saying that is the name of my chapter. Positive Psychology and Positive Psychiatry was published by Springer in 2020. That is an excellent resource if you're looking for kind of an academic source. Certainly, the GPHI is an excellent resource. Martin Seligman's books are great resources as well. I came across recently, if someone's interested in looking more into positive psychology and culture, a recent book, African American Psychology, a Positive Psychology Perspective by Dr. Stacy Kraft DeFreitas is also a good resource. It seems that this is a field that is just growing, and every time I do a search, there are more resources that are popping up, and that's very exciting, including resources that are looking more at culture and positive psychology.
Yeah, great. Thank you for that. And as you were mentioning these resources, you're mentioning the terms positive psychology and positive psychiatry. And it was fairly recently that I was exposed to this term of positive psychiatry. Can you mention just a little bit more about what that's about and how maybe our audience can have a new insight into, is it a segment of psychiatry that has a different approach?
I would, for my personal view, is that they're very much the same, and the idea, of course, positive psychology arose from Martin Seligman is a psychologist, and many of the people who've done the writing early on about positive psychology were coming from the standpoint of being psychologists. Psychiatrists, I think, have been later adopters of these principles. But I think the approach is still is still the same. Of course, in psychiatry, most psychiatrists, although there are many of us, some of us who still do psychotherapy, myself included, many psychiatrists primarily are focused on prescribing medication. So there is a different dynamic that is at play when your primary work with a patient is in that medical model. So finding ways to take the principles of positive psychology and infuse them into psychiatry. But I see those two areas as being pretty much the same. But I think that, again, psychiatry has been later into the positive game than psychology.
Thank you. Thank you for that. Well, we're just about at the end of our podcast. Do you have any last words of wisdom? Anything else you'd like to share?
It's just been a pleasure to be with you today and to have this conversation. It really is, it's exciting to see where this field is going. It's exciting to see something that really has the ability to resonate so broadly, and particularly in the times in which we're living, having new approaches to addressing the struggles that people face in a way that just in and of itself is an uplifting one that gives people a sense of hope and optimism, and that allows them to tap into the strengths that they already have, is really, really exciting and gives me hope for the future.
Well, thank you. Thank you so much for joining us today, Dr. Duncan, and thank you to our listeners for following the Global Positive Health Institute at positivehealth.world and our various offerings through YouTube and these podcasts. And we hope to see you at another one of these episodes. Please like us, and we'll see you next time. Take care, everybody.